Welcome to the 2022 City of Sheboygan Employee Benefits presentation. Throughout the year of 2021, the City of Sheboygan's Health and Wellness Committee has worked hard to review our employee benefits package offered to all city employees. During that time, we compared our plan to other plans in the public sector, similarly sized companies, and in the Midwest, and found on average our plan to be comparable or richer than other plans offered. The plan design changes that we did make this year were made, though, to enrich our benefits with minimal cost increase to our employees. To take a step back, in 2020, the city had intended to increase the employee portion of the premium to 9% in 2021. However, we delayed that due to COVID. In 2022, we will be moving the cost share from 8.5% of the monthly premium to 8.75% for full-time employees. We are also pleased to announce that the City of Sheboygan will be making an HSA contribution to those on our medical plan in January of 2022. If you are on an employee-only plan, non-transit, the amount contributed will be $750. Transit employee-only plan will be $600. Non-transit plan for a family plan, employee plus spouse or employee plus children will be $1,500. And for transit family plans, that contribution will be $1,200. To highlight our benefits for 2022 that are remaining the same, our Sheboygan in-health clinic through Helix in partnership with Sheboygan County and the school district will remain the same. That in-health clinic is on Pennsylvania Avenue, and you can go there for wellness visits. If you are feeling ill, it's not a walk-in clinic, but you typically can make a same-day appointment for that clinic. They do also offer flu shots and are offering the COVID boosters coming up, and other services, including a chiropractor. We will be continuing with Go 365, our short-term, long-term life insurance, and cancer and hospital indemnity plans through American Fidelity will also continue into 2022. And if you are on the United Healthcare Voluntary Critical Illness and Accident plans for those grandfathered employees, those will remain in place also. One highlight I do want to share for employee benefits coming in 2022 across all plans is actually the No Surprises Act. This doesn't deal with our plan specifically, but is an important healthcare reform change. So in December 2020, the No Surprises Act was signed as part of the Consolidated Appropriations Act. This goes into effect again on January 1st of 2022. What it does is to establish standards to protect patients from what's called balance billing for defined items or services that are provided by doctors, hospitals, or ambulances on an out-of-network basis. So it applies to out-of-network emergency covered items and services, including ambulances, medical items and services performed by an out-of-network provider in an in-network facility, or out-of-network air ambulance items and services. So what happens in this situation, or has happened in the past? You made the decision, you went to an emergency room that you felt was an in-network hospital or emergency room. However, in the process, you were seen by a doctor that hospital was contracting with who was not in network. It may not have been one of their doctors, but they brought them in to help cover, and it was an out-of-network doctor. In that case, you could get what was called balance billed. So UMR, our healthcare provider, would say, yes, we paid what is called the reasonable and customary rate, but the healthcare provider would come back and say, no, you still owe me X dollars more. Starting in 2022, that will no longer happen. Employees will not be able to be balance billed for these emergency services. If you still choose to go to your out-of-network doctor for your primary care visits or a sick visit or things like that, then you can be charged. It's just for those emergency services that this will apply. Our medical and RX, our medical plan will be staying with UMR for 2022. Our RX will stay with Optum RX, but we will be moving from RX benefits to UMR as the processor. Plan highlights for our medical and prescription plan. In 2021, the City of Sheboygan's plan has a $1,500 deductible for individual, $3,000 for family. However, after the deductible, we had a separate medical out-of-pocket maximum and a separate pharmacy out-of-pocket maximum. What that meant was that if you had a major medical claim, let's say in February, and you met your $3,000 individual out-of-pocket maximum on that plan, but then you had to take maintenance medications or ongoing prescription medications, and each month you had to pay that copay for that prescription, you would have had to pay more above and beyond that $3,000 out-of-pocket maximum up until possibly you hit your pharmacy out-of-pocket maximum of $2,550. In 2022, those amounts will be combined. So your medical and RX out-of-pocket maximums are combined to the $3,000 for individual, $6,000 for family. If you are on a family plan, there is an individual deductible within our family plan of $4,500. So that means if I am covering myself, my spouse, my two kids, if I'm the only one with medical claims, the most that I can pay out of pocket for myself is $4,500. Then if my daughter or my husband has to have medical expenses, has medical expenses that they incur, we would owe an extra $1,500 yet until we hit our $6,000 family out-of-pocket maximum. Coinsurance. After you've met your deductible, the plan pays 90%, you pay 10% for services like lab work, hospital visits, anything like that. The plan is going to pay 90%, you're going to pay 10% until you hit your out-of-pocket maximum. For a primary visit, if you're going in after your deductible, you're paying a $30 copay. Specialist visit, $50 copay. Your preventative care, no matter when you receive that, covered at 100%, no deductible applicable there. And your emergency room visits is $150 copay after your deductible. Before you've met your deductible, you're responsible for what's called the full negotiated cost of any of those appointments up until your deductible. An example of this would be my daughter had ear infections when she was little. We were on a high deductible healthcare plan at the time. The doctor's office said $150 for this appointment. Our healthcare provider or our health insurance came back and said, nope, shouldn't cost them more than $130, doctor. They only owe $130. You need to write off the extra portion. That is the portion of having health insurance still, that you still get that negotiated rate up until your deductible. So while we have combined the medical and RX out-of-pocket maximums, the copays for the prescriptions have not changed. If you are going to a pharmacy and picking up a 30-day supply of a generic medication, $15 copay, a preferred brand, a $30 copay, or non-preferred brand, $40 copay. If you go to that same pharmacy and you pick up a 90-day supply, so a 3-month supply, you're going to pay 3 times that copay expense. Now, if you go and do that same order on a mail order pharmacy for a 90-day supply, you're actually going to pay 2 months copay for a 3-month supply. So that is a way that you can look at your plan and say, hey, how am I taking best advantage of my plan? Is that an option for me for my maintenance medications or ongoing medications? Preventative care. As I mentioned, preventative care is covered at 100% on our medical plans for all of our employees. What is considered preventative care? Routine preventative care for children includes their newborn visits, their 2, 4, 6, 9, all those visits before a year old, their lead test at a year old, and any other annual appointments, along with their vaccinations up until through their childhood years. As an adult, your lipid profile, your blood cholesterol profile, your diabetes testing, your pap testing, mammograms, PSA testing, bone density testing, colonoscopies are considered preventative care. In 2022, the routine age for a colonoscopy reduces from 50 to 45. So if you are at that age, do know that as of 45, it is now considered a preventative service where it would be covered by your plan at 100%. So what's happening to those amounts that are coming off your check in a premium format for this upcoming year? I mentioned that we're making the employee portion go from 8.5 to 8.75% of the monthly premium. That does mean on a single individual plan that you are going to go from $76.60 in 2021 to $80.04 in 2022. On a family plan, you're moving from about $201 to $210.44 for a monthly premium. All deductions are on a pre-tax basis for the medical plan, and spousal surcharge does apply if your spouse has access to coverage through their employer and does not elect at least single coverage through that plan. That spousal surcharge will apply. So how do our medical benefits compare to other benefits in the area? This was a huge focus of the Wellness Committee this past year to make sure that our plan was comparable or offering more benefits than other plans in the area. So in the first column, you'll see the city of Sheboygan's deductible and out-of-pocket maximum. Then next, the public sector, our 250 to 500 employee area, and then the Midwest. You will see that our deductible and individual and family deductible come in at about half of the average individual and family deductibles. Our out-of-pocket expense or maximum is lower for both the individual and family portion on all of those plans, and our medical co-insurance, what you pay after your deductible is met, is lower on all of the plans. Across the other areas, we are within about $50 for copays for all appointments and also for prescription medications. The HSA employer funding, most of our funding is actually higher than the average for both single and family for those that were able to identify that information. From a premium perspective, while our monthly premium might be higher, if you look at the portion that the employee is paying for premiums, that amount is significantly lower than on the average plan. Throughout the plans, you will notice that the city, next year it'll actually be 91.25% that the city pays, but on an employee only or a family basis, the city pays 91.25% of your premium. Other employers typically average on an employee-only plan between 80 and 85% that they pay, and on a family plan between 70 and 75% that they pay. So the city of Sheboygan does pay a higher portion or percentage of the premium than the average employer. Continuing to a benefit comparison of our overall benefit plan, when you look at medical, the RX, the copays, the prescriptions, all of that, our actuarial value comes in at 89% or viewed to be a market leading plan. So when you look at our plan, we're better than about 89% of the plans out there from a coverage perspective overall, and about 11% of the plans might offer some richer benefits, but those are considered to be outlier plans. Coming new for 2022, we are offering Teledoc. Teledoc is a virtual visit phone call with a doctor at any point in time. You can do this 24/7, available to employees for everyday care such as colds, flus, sinus infection, ear infection, pink eye. If you're dealing with like a bladder infection, they typically can help with those types of services. The visit before your deductible is going to be $49 per visit. After your deductible, there's a $0 cost share. Teledoc also offers mental health care. This is available 7 days a week from 7 a.m. to 9 p.m. It can offer you a visit with a therapist, a psychiatrist. The costs are different than the everyday care. And then the dermatology also, that is available for any sort of skin issues that you're dealing with. You actually upload images of the problem area to the website, and then you would get a custom treatment plan from a provider within 2 days. Again, for the everyday care, it is going to be $49 before your deductible, after your deductible, a $0 cost share for our employees. You can do this again from anywhere. Typically takes about 10 minutes in the virtual waiting room once you're logged in before you're connected with a doctor. And then once you're connected, probably about 10 to 15 minutes with the doctor, and they can prescribe prescriptions if they feel that is necessary to prescribe like an antibiotic. They can send that over to any local Walgreens for you. I've used this in the past when I was camping across the state, wasn't feeling well, was able to do Teledoc and not have to worry about trying to find an in-network provider in an area that I wasn't familiar with. Was also able to do this about 6 or 7 o'clock at night, get a prescription sent over to Walgreens to get me feeling better before the next day. So after talking about our medical benefits, the one thing I always like to wrap up with is, how do I maximize my benefits? Are you utilizing in-network facilities? Do you know where your in-network urgent care is? Your doctor's office, do you know what their hours are for you to make appointments if you need to, for sick appointments or things like that? In looking at that for my own family a few years ago when we were living in a different area, I actually found out that my daughter's pediatrician's office had office hours on Saturdays and Sunday mornings. So if my girls were sick, I may be able to get them in for a sick appointment on those mornings versus needing to take them to an urgent care. Additionally, they're kind of doing this evaluation, having this real life scenario play out, looking at the costs associated with an urgent care versus an emergency room, and knowing what services you can go to an urgent care for is very important. Throughout our years, both my daughters have broken their arms. My first daughter was 15 months old when that happened, and we took her to Children's Hospital. We felt that that was kind of important for her to have that level of care at such a young age. However, we took her into the emergency room on a Sunday night. All said and done, when she got her cast, all of her doctor's bills, our total bills came to about $4,500. Fast forward a few years, my now 8-year-old falls rollerblading, breaks her arm. Neither of these are obvious breaks, small fractures, can't tell, they're not, bones sticking out of the arm or anything like that. We were able to get her into her doctor. They were able to send her over for an x-ray. All said and done, our total bill for her medical care came to about $1,200. So again, basically the same break, same level of service or same services, and about a $3,000 difference. So again, knowing what your options are is very key to making sure you're maximizing your benefits. Please, if you need to go to the emergency room, do so. If it's that life-threatening emergency, make sure you're going in and taking care of that. But again, knowing where those options are for those urgent care services is important also. Have you had your preventative exam? If you catch things early, it can help prevent future medical expenses. If you catch diabetes in like a pre-diabetic stage, or catch it early on versus having symptoms and issues that are uncontrolled for many years, it can save so much damage and medical bills that you would have in the future. Know where you stand in regards to your deductible, coinsurance, and out-of-pocket maximum. Have you met your out-of-pocket maximum yet? Have you met your deductible? Review your explanation of benefits. Make sure you're comparing it to your provider charges. If you get billed by your provider, make sure you've received your explanation of benefits and the amount that you're responsible to pay matches up. Also, take a peek at that explanation of benefits. Make sure that they're charging you for the services you receive and not for something else. Through doing this, actually for my dental, not medical, but dental expenses, found out that my dentist's office charged or sent into my insurance that I had received x-rays. However, I did not receive x-rays at that visit. I was supposed to receive them. They had put it in before I came into the appointment, but when I came in, I let them know that I was expecting and could not receive the x-rays, therefore did not do them. They just never took it off of what they processed through to insurance. So make sure you're checking that explanation of benefits. Little transition over to dental here. Our dental plan remains with Delta Dental of Wisconsin. Plan highlights the deductible is the same. The annual maximum benefit is the same. Your preventative service is still covered at 100% with no deductible. From your basic and major services, the percentage that is covered after your deductible remains the same, and orthodontia remains the same into 2022 also. What we did add for 2022 as an added benefit is that your diagnostic and preventative services, including your exams and x-rays and your cleanings, do not apply to your individual annual maximum. Therefore, that remains or keeps that $1,500 annual benefit for any actual needed non-routine dental care, such as a cavity, a crown, a bridge, anything like that. So that can save you a couple extra dollars or towards any of those types of services that you need, even if you go in for those cleanings, which you should be doing twice a year. Evidence-based integrated care. There's a lot of proof out there that teeth cleaning for certain medical conditions is necessary, or additional cleanings are necessary. Again, pregnancy can lead to gum disease or gum issues with your oral health. Also diabetes, cancer, periodontal disease, some heart conditions, kidney failure, or dialysis, or if you're dealing with a condition that causes a suppressed immune system. If you have any of these conditions, you can actually receive up to 4 cleanings at a dentist's office per year just by self-enrolling in this plan through Delta Dental. There's a 1-800 number that you can call. There's no medical claims or authorization needed to be submitted or filed with Delta Dental. You just call and enroll in this program. 2 other things that I want to mention on our dental plan for 2022, we are moving the sealants for children up to age 19 for coverage. And also for our dental, we are adding in limits for x-rays. These are pretty standard limits across the industry. Our plan, for whatever reason, just didn't have them in place. So those limits are 1 bite wing x-ray every year, 1 full mouth x-ray every 5 years. Premium costs, no changes in the premium cost to our employees. $7.14 for an employee on a monthly basis, $23.62 for a family plan. Vision. We did make a change to our Vision Network and Vision plans this year. Our Vision Network is changing from Superior Vision to NVA Vision. We are continuing to offer a materials only plan. We will also be offering a full service plan. So the City of Sheboygan's medical plan covers your eye exam in full, no cost to you. However, maybe you have medical insurance through another employer, and you're like, yeah, I need that vision exam. I got glasses, I need that vision exam every year, and I need to get my materials. We are now offering what's called the full service plan, which would cover your vision exam in full also. On both plans, we did change the frequency for frames from every 24 months to every 12 months. Other than that, the materials only plan remains the same as what it was from a coverage level. Your standard traditional lenses are paid in full. Frames are covered up to $125 value with a 20% discount after that, and contact lenses covered up to $150. And then if they're medically necessary, they're paid in full. That is pre-approval required. Fitting and follow-up would then be included there. However, the plan design from that perspective remains the same, other than the frames moving to every 12 months instead of 24 months. Cost for our employees, that is actually being reduced. $6.10 for materials only plan for an individual per month, $16.18 for a family plan. The full service plan is going to cost a little bit more because it does have that added benefit of covering your eye exam. $9.14 a month for an individual, $24.22 for a family. With NVA, there are nearly 100,000 vision care access points throughout the 50 states. Anything from optometrists, ophthalmologists, and opticians, including private practice and national and regional locations. e-nva.com is their website. They also do have an app that you can access through an Android or iPhone. You can create a new account and find your providers right there. In-network providers do include Walmart Vision Center, Target Optical, Vision Works, Wisconsin Vision. The one in the Sheboygan area that I noticed that we are probably losing from Superior to NVA is Prevea. If you are going to Prevea for your eye exam and you are on the medical plan, you are probably okay. However, for your materials, you would not be able to use your materials on an in-network basis through NVA. Other programs that NVA offers to our employees includes a discount on LASIK, mail order contact replacement program, a hearing aid discount program where you can save 30 to 60% on hearing aids and related services, and savings on additional materials purchased through iEssential. Additionally, I know a lot of times when I used to wear glasses before I had my LASIK done, I'd go into the vision office and be like, okay, if I get those glasses, how much is that going to cost me with that extra coating, that extra tinting, all of those things? So they actually have a smart buyer library where you can go on either their website or their mobile app and research beforehand what those lenses and additions would cost you and how they would work best for your budget. They also have the option where you can view how many different types of styles of frames you have at zero or low cost to you based on your plan design. Still struggling with additional questions? They have 24/7 customer service available to answer any questions that you have. HSA and FSA spending accounts. Want to talk a little bit more about HSAs? I mentioned earlier that the city will be contributing to employees' HSA accounts in 2022. An HSA account is a health savings account. It's an account that is open in your name. Always your money. Any money in that account is always your money. You can use it to pay for medical, dental, or vision expenses. It is a tax-free account if you set the money aside through payroll deductions, or if you don't set it aside through payroll deductions, you actually have the ability to claim it on your taxes at the end of the year. And as long as you pull the money out for qualified medical expenses, it remains tax-free. There are a few rules. You have to be eligible for an HSA. We'll talk about that on the next slide. And you have to spend the dollars on qualified medical expenses. And you want to make sure you keep your itemized receipts. So if you ever get audited by the IRS, that you have those. So are you eligible for an HSA? You have to be covered on a qualified high deductible healthcare plan. The city's plan qualifies. If you are or have been enrolled in Medicare, TRICARE coverage, VA, or HIS non-preventative coverage within the last 3 months, you're not eligible to contribute to an HSA. If you're claimed as a dependent on somebody else's tax return, also not eligible to contribute to an HSA. Lastly, but not least, is that if you or your spouse contribute to a flexible spending account, and this is one that not everybody knows, if your spouse contributes to a flexible spending account through their employer, you are not actually able to contribute to an HSA through the city. We also offer FSAs. If you're on an HSA plan, you would need to do a limited purpose FSA. A limited purpose FSA is only good for dental and vision expenses. So again, our plan design, our medical plan with UMR, they're going to process your plan looking at your deductible, your co-insurance and co-payments, and your out-of-pocket maximum. That's the one that provides the insurance protection, but it works in conjunction with the HSA, that all those dollars that you set aside into your HSA can help you cover your out-of-pocket responsibility. Any unused balance does roll over from year to year. You never forfeit any unused dollars. Those can come with you all the way into retirement. So how much is the city contributing for 2022? Again, a non-transit individual on an individual plan, $750. Transit, $600. A family plan for non-transit, $1,500. Transit, $1,200. You can contribute to your HSA yourself also. How much you can contribute is regulated by the IRS. In 2022, for an individual plan, that's $3,650, and family is $7,300. What the city contributes has to come off of that amount. So on top of the city contributions, if you're a non-transit employee, you could put an extra $2,900 in on an individual basis. If you are 55 years of age or older, you can contribute an extra $1,000 into your account each year as a catch-up contribution. Additionally, if your spouse is over 55, they can contribute an extra $1,000 into an HSA each year, but that has to be done into an account that is opened in their name. It cannot be done through your account. So who can I spend those HSA dollars on? You can use your HSA for yourself, your legal spouse, and any tax dependents, even if they aren't on our plan. So if your spouse carries herself and the kids on her plan or his plan, or your spouse is on their plan because of not being on the city's plan due to the spousal surcharge, you can use your medical HSA for their expenses. You cannot use it to pay for the premiums for their plan, but you can use it to pay for their copays and deductibles and out-of-pocket expenses in that way. So what is an eligible expense? A complete list is in IRS code 213. Typically, if you just even do a search online, you can find a list of eligible expenses. It does include medical, dental, vision expenses. Over-the-counter medications are now allowed without a prescription again, starting in 2020, and they have actually opened it up to cover feminine hygiene products also at that point in time. So if you need glasses, LASIK can actually be covered under an HSA. If you need contacts, contact solutions, all of those can be covered under an HSA and FSA. Under an HSA, you can pull out expenses on a tax-free basis to pay for premiums for COBRA, or if you're looking for medical insurance coverage while you're unemployed, and to pay for Medicare premiums. However, if you are moving to another plan, you cannot use your HSA to cover premiums for that plan under another employer's plan. You can use it to pay for those copays and deductibles and out-of-pocket expenses on that plan, just not to pay for the premium. Okay, so flexible spending accounts. We talked about HSAs, how they're not use it or lose it, how they carry over from year to year, how that money is always yours. A flexible spending account, a full purpose FSA, can be used for very similar expenses to an HSA, but it is a use it or lose it account. If you don't use that money by December 31st of the year, you do lose it. However, the full amount is available to you on the first day of the plan year. So if you come in and on January 1st, you elect $2,000, and on February 1st, you have a major dental expense or major medical expense, that $2,000 is there for you to use. If you did an HSA and you said, I want to put $2,000 in throughout the year, it's a true bank account. That $2,000 isn't in there if you broke that up over all of your different payrolls. Be aware that what your elections are for your FSA for the year are irrevocable unless you have any sort of qualifying event change of a marriage, divorce, birth, death of a dependent, adoption, things like that. So watch out for that use it or lose it rule. Again, January 1st through December 31st. Dependent care FSA follows the same use it or lose it rules. This account, though, however, is to pay for childcare expenses. Setting aside up to $5,000 annually for medical or for dependent care expenses, to pay for daycare, childcare, before and after school programs for your dependents up to age 13, or adult daycare as needed. Your provider does need to report this on their taxes. So my girls went to an in-home daycare provider for their whole career. She reported on her taxes. I was able to use this account. If I said, hey, mom, want to watch my girls, and I gave her a little bit of like cash under the table for watching them, I would not be able to use the dependent care account in that way. Switching gears from medical, dental, vision to our employee assistance plan. Our employee assistance program is through Advocate Aurora. It is available to all of our employees with the city, whether you are part-time, full-time, whether you take our benefits or you don't. If there's any sort of issue that you're dealing with that's starting to just occupy too much of your time, it interferes with your normal activities or persists for more than a few days, please give the EAP a call, aah.org/EAP, or the 1-800 number on the screen here. We in HR do have flyers, little cards for this. So if you need some for your area, please reach out to HR. We're happy to send those on. The EAP can help with things like drug and alcohol abuse for yourself, for a family member, anxiety or depression, caring for aging parents or childcare concerns, financial pressures, legal issues or relationship worries, and so much more. As I mentioned earlier in the program, we are continuing with Go 365, our wellness program for 2022. In 2022, employees will need to keep the best premiums for 2023. You will need to complete your biometric screening and the health risk questionnaire. These will be tracked through Go 365 and need to be done by October 1st of 2022 in order for you to get the best premiums in 2023. The full details of which percentage you'll pay if you didn't do any of the wellness incentives versus what you'll pay if you did do the wellness incentives will be released partway into 2022, so keep an eye out for those. So Go 365. With Go 365, you can earn points throughout the year to earn your way up to platinum status, and along the way, those points actually earn you bucks that can be cashed out in the Go 365 mall. The two things, again, that you're going to need to complete are the health assessment. The health assessment is that 6-section questionnaire. Things like how much sleep do you get? How many times a week do you eat 3 servings of fruits and vegetables? How much exercise do you get? How often are you stressed? Things like that. As you complete each of those sections, you earn points, and you'll get bonus points for completing all 6 sections. Additionally, if you complete it within the first 90 days of the plan year, you get additional points for doing that also. The second portion, again, is the biometric screening. The biometric screening is that BMI, height, weight, blood pressure, total cholesterol, glucose readings that you're going to do. If you go to your primary care provider and they are doing a biometric screening or blood draw for you anyway, you can submit those results to Go 365 directly. You do not have to wait for the city to do an on-site biometric event in order to submit that. Just know that if you're doing it through your primary care provider, that you need to submit the results within 90 days. It doesn't matter what your results are next year. You just need to do these 2 action items. When we run the report as an employer, all we see is that on January 15th, Joe went in and did his health assessment. And then on February 20th, he went in and had his biometric done. That's what we see, just the dates underneath the column of health assessment and biometric. Again, as I mentioned, throughout Go 365, you can earn points for completing different actions. Steps, it's 1 point for every 1,000 steps that you take. That can be monitored by a smartphone that you might carry in your pocket, or a smartwatch, a Garmin watch, Fitbit watch, Apple, etc. Your heart rate monitor, if you're wearing a heart rate monitor that has an app that can sync with Go 365, 5 points for every 15 minutes that your heart rate is above 60% of your maximum heart rate. Calories, 5 points for every 100 calories burned at a rate of 200 calories an hour or more. And then if you check into a participating fitness center, you can earn 10 points. Additionally, starting in 2021, Go 365 actually opened up that you could take a picture of yourself doing your workout, or maybe you were on the elliptical and you took a picture of the elliptical at the end, and you could upload that for 10 points instead of checking into a participating facility. That was meant to allow for at-home workouts. So if you're doing like an at-home maybe workout program too, and you can upload proof of that, that should work also. Prevention, if you're going in for your mammograms, your colorectal screenings, your health, your dental and vision exams, you can upload those for points. If you're first aid certified or going through, there's just even online health calculators that you can do that says, how many calories will I burn if I bike for 30 minutes at a rate of 6 miles per hour? If you do a sleep diary or passing a nicotine test, you can get points for all of those items also. Some resources upcoming and currently available to our employees. Our broker, USI, will be offering an app to our employees where you'll actually be able to go in, find a benefit guide with all of our information, find little videos with information about HSA or FSA or different terminology or different questions that you might have on benefits, and also be able to access things like your wellness program, EAP information, all of that within the app. Additionally, if you're dealing with a claim question or dealing with a concern with your insurance and you're like, I don't want to come to Jen because I don't want her to know my medical information, that is fine. You can go to the Benefit Resource Center available through our brokers, USI, available from 9 to 6 Monday through Friday at the 1-800 number listed down below. They can help work directly with you and the carriers to resolve any issues related to claims or denials, etc. And then Real Appeal. Real Appeal is a weight loss disease prevention program. It's a once per week meeting with a health coach where you meet in a group setting and have an online discussion for all participants. And then if you have certain requirements that you met, you can actually do one-on-one coaching also. Personalized support available to you, tools to help support your success based on your individual needs. Things like nutrition guides, meal plans, even things like how to shop at the grocery store, the fact that your fresh produce, your dairy, etc., are on the outside of the store typically, and your processed foods like your chips and soda and such are in the middle aisles. So staying on that outside ring of the grocery store as you're shopping can make for healthier choices. Okay, our open enrollment process for 2022. In October of 2021 here, you've completed your open enrollment benefits education, and now you need to review and make your elections. We will be having on-site meetings with American Fidelity the week of the 25th to the 29th, and virtual meetings available until November 5th. We are sticking to the November 5th deadline in order to ensure that we can get information over to our carriers in a timely manner. This is your one time a year to say to me, hey, Jen, I don't need that dental or vision insurance anymore, unless you have a qualifying event. Otherwise, you are locked in for their medical, dental, vision insurance through the rest of the year. So what's a qualifying event? You have a marriage, divorce, a death in the family, birth or adoption of a dependent, change in employment status, or your spouse has a change or child has a change in employment status. Your child's at that age where they're, finishing up college, getting their own job, and now they're eligible for insurance through their employer, you can make a change at that point in time. If your spouse loses a job or has a change and starts a new job, and you want to compare their insurance to ours, that's a time for you to make a change. All of these changes need to be done within 30 days from the date of the event. So if you know of your marriage coming up, you know when that date is, you know that birth is coming up and you're going to be having a baby in a couple of months, please reach out to me. That'll put it on my radar to stay in touch with you. It is ultimately your responsibility to come back to HR within 30 days of that date of that event. Do know that 30 days is not our regulation. That is a federal regulation. If you get past that 30 days, you may not be able to make, or more than likely will not be able to make that change until the next open enrollment period. So if you get past 30 days and all of a sudden you're like, hey, I need to add baby to my plan, I'm sorry, baby doesn't have coverage until next open enrollment. So again, October 25th through the November 5th is our open enrollment period. On-site meetings available from October 25th through the 29th. Any changes that you make to your plans will be effective January 1st, and the payroll changes will take effect on the 1/7 payroll. If you are opening an HSA account for the first time, we need that information by December 1st in order to ensure that we can process your bank account information in time for you to receive the city contribution in January. The spousal surcharge will remain at $100 per month in 2022. You must submit a waiver form to HR by November or December 15th. Either way, if you have your spouse covered on our plan and you're like, yep, they've got offers of coverage to their employer, but we accept the $100 surcharge per month, there is just a box that says, yes, my spouse is employed and I accept the spousal surcharge. You sign the form and return it to me. I need nothing further. That is available in ESS. Additionally, every employee does need to complete the open enrollment process. If you don't complete the open enrollment process with American Fidelity, you won't have coverage in 2022. If you do not take any benefits through the city, whether that's short-term, long-term, any of those ancillary products other than those through ETF or life insurance through the state, any of those other products through short-term disability and life insurance through American Fidelity, don't take medical, dental, vision, there is a waiver form that you can just complete versus going through the meetings. But for most employees, you've elected at least one product, you're going to need to go through that meeting with American Fidelity. No enrollment changes are accepted after the open enrollment period unless you have a qualifying event. And then here's my contact information. You can also find my phone number on the city website if you are ever not able to locate this presentation. If you have any questions, please give me a call, send me an email, or feel free to stop by City Hall. I'm happy to answer any questions that you might have. Thank you.